Hello, this recording is going to be over chapters 10 and 11 of Donna Larson's Clinical Chemistry. We are covering cell injury and inflammation. Alright, so we're going to look at a lot of cases in these two chapters. So we're going to start with Robert. Robert has wine and other alcoholic drinks on a regular basis and has done so for many years. Because alcohol is processed by the liver, he is at risk for liver damage. So how would damage occur to Robert's liver? That's the first question. And which lab test can assess the level of liver damage that Robert has sustained? Okay, so the first question then that was asked is how can damage occur to Robert's liver? So one thing you have to know is that alcohol is a toxin that it really has no use, nothing useful. The body cannot do anything with it. So as soon as alcohol hits the body, the liver has to try to process it and get rid of it. And that could cause, if it happens over time, it can cause damage. Initially, it tends to lead to things like alcoholic fatty liver disease, and then those can progress as it gets more severe and sustained for decades. Then it can progress to liver cirrhosis or alcoholic liver cirrhosis, or even alcoholic hepatitis, where the hepatocytes just get worn out and damaged from constantly having to process this toxin that alcohol is. And the next question then was, which lab test can assess the level of liver damage that Robert has sustained? So your choices are going to be the AST, ALT, and GGT, CK and LD, CBC, and amylase and lipase. So we've already addressed a lot of these tests in our enzyme chapter a couple chapters ago. And so the answer here that makes the most sense should jump out to you is going to be AST, ALT, and GGT. GGT is often used to screen alcoholics to see if they've been sober, or if they're still drinking. And then AST and ALT are hepatocellular enzymes that are released when hepatocytes are damaged. So let's talk about the types of cellular damage then. So the cells have adaptations to maintain homeostasis. As we talked about in chapter 9, the cell's job really is to maintain homeostasis in the body, but also just cellular homeostasis. So sometimes atrophy can happen, or hypertrophy. Those will affect cell size, so they can get smaller or larger. And you can get hyperplasia and metaplasia. And hyperplasia is the cell number that is increased, and therefore the tissue will be thicker and take up more space and have more of those cells in it. And then metaplasia changes the type of cell. An example of metaplasia would be, as we discussed in the chapter before, where smoking can cause your pseudostratified columnar epithelium that lines your trachea and your bronchi to be replaced by stratified squamous epithelium, which functions differently. The types of injury that can cause cellular adaptations to happen can be genetic, nutritional, immune, endocrine, physical, chemical, infectious, and ischemic. So genetic meaning genetic changes, could be changes in the code, or it could be epigenetic changes. Nutritional, some of the cellular injuries could be due to deficiencies in micronutrients such as vitamins and minerals. It could also be overfeeding with too much glucose in the body. Immune could be, for example, an autoimmune where your immune system attacks the healthy tissue. Endocrine, it could be because of various endocrine abnormalities, excess of certain hormones, or not enough of certain hormones. And physical injuries, of course, that would be trauma, car wrecks, falls, that kind of stuff. Chemical would be exposures to chemicals, whether it's inhaled through the skin, ingested. Infectious agents, and ischemic is lack of blood flow, which then causes lack of oxygen, which then causes cellular damage. So in Robert's case, the hepatocytes are damaged by chemical injury, caused by alcohol. It's a toxin. The injury causes a loss of function, apoptosis of the cells, and the liver becomes scarred, which then leads to cirrhosis, and then loss of function in the liver. As they are damaged, they release some of their enzymes, which are AST, ALT, and GGT. All right, so let's talk about systemic manifestations of cell injury. So how do you know that your cells are being injured? So one of the first signs might be fever. Fever is due to the release of endogenous pyrogens from those cells that are damaged, and due to acute inflammation. So your body temperature goes up, so you know you're getting sick, that something is going on. An increased heart rate, which is usually due to an increase in metabolic processes, which can come from the injury, usually the immune system working, the increased demand on the body trying to fix and repair the imbalance. An increase in white cells, obviously if it's an infectious process, demobilization of the white cells to fight it off. Pain can be a sign of injury. The release of bradykinins causes pain, and then anything that is obstructed will lead in pain, and then pressure. Usually the obstruction causes pressure, but anything where there's an increased pressure, you'll get pain. The detection of cellular enzymes that have been released, such as LD, CK, AST, ALT, alkaline phosphatase, amylase, lipase, aldolase. In Robert's case, of course, you would see increases in those enzymes, AST, ALT, and GGT. And in the late stages of cirrhosis, jaundice and some upper right quadrant pain. Your next question then is, list another condition that would exhibit one or more of these systemic signs of cellular injury. So again, we just listed several. So what's a condition that would cause fever, or that would cause pain, or that would cause an increase in enzymes, etc. Next, we're going to move on to Lisa's case. Lisa's lifelong goal was to climb Mount Everest. She has been training for months, and she heads up the mountain with a team and a guide. They get caught by an avalanche. Rescuers find Lisa after searching for the team all day. She is taken to the hospital. She has suffered from frostbite on her nose, earlobes, and fingertips. They were purple when she was found, and she ends up losing part of her nose, earlobes, and a few fingertips. So what caused the injury at the cellular and tissue level that resulted in her loss of a few bits and pieces, and what tests could be done to detect this or to assess her? All right. So again, what caused the injury? Again, don't be looking too far. It's pretty obvious here. She was on top of a mountain caught by an avalanche, okay? And the second question then is, what test would detect this? What test you think would be abnormal? And so I would say of the tests, again, the same ones listed. Potentially the CBC if infection was starting to set up, but I would go with CK and LD because the CK is contained in muscle. So as some of that muscle got injured, it would be released. And then LD is contained in pretty much all your cells. And so any kind of cellular damage could increase the lactate dehydrogenase. So let's talk about cellular injury that can be caused by hypoxia, trauma, heat, and cold. So hypoxia versus ischemia means hypoxia is not enough oxygen. Ischemia is not enough blood flow. So obviously ischemia, not enough blood flow, would lead to hypoxia in the tissue. And it's worth noting that hypoxia can cause some acid-base imbalances because as the tissues lack oxygen, then they are going to still try to survive and produce ATP, and they're going to do that simply by glycolysis and not by the Krebs cycle, which is an aerobic process. Glycolysis is anaerobic, so it does not require oxygen. Therefore, you can do it in a hypoxic environment. But the side effect of that is the pyruvate, instead of entering the Krebs cycle, is going to be made into lactic acid. You'll have a bunch of lactic acid that's going to be made, and that will affect the pH and cause it to be acidic, there will be more about all of that in the acid-base chapter coming up. Trauma disrupts the cells, tissues, and organs. So, getting in a car wreck, falls, stabbings, shootings, all of that. With trauma, you usually see hemorrhage, so blood loss, and ischemia, lack of blood flow to a certain area. For example, if a major artery get cut, and then anything down from that would not be getting blood flow. Heat can cause cellular leakage of ATP. That would be with mild heat, so mild burn or maybe a sunburn. But intense heat liquefies the cell membrane. So that would be like being in a, like really 3rd-degree burn. And that's how it causes injury. Cold, the water in the cells freezes. Then those form crystals because, like ice takes up more room than liquid water. The crystals causes the cell to rupture, and then you get necrosis, and that's how she lost her nose and fingertips, or parts of her nose and fingertips, and so on. So when the rescuers found Lisa, she was not totally submerged in snow, nor did she have any obvious injuries. So what other mechanisms other than frostbite could have caused cellular injury? So what do you think? Hypoxia, ischemia, or trauma? So of those three, I would say probably ischemia, because when you have hypothermic conditions, your circulation is going to go to the center of your body, just try to keep your organs and your brain warm, and it's not going to be worrying about trying to keep your fingertips and your ears and the tip of your nose warm, and so you'll have lack of blood flow there, and so that ischemia can also cause the injury in cold. All right, moving to Perline's case. Perline suffered a chemical burn to her lungs this summer while she was mixing chemicals to treat her pool. She mixed bleach and ammonia, or 2 different chemicals that weren't supposed to be mixed. It is now wintertime, so this is later. So this happened in the summer. It's now wintertime and she has pneumonia. So what kind of cellular damage has she sustained from her lungs initially? How will this affect her long term? And what diagnostics tests can help assess this type of cellular damage? All right, so what kind of cellular damage has she sustained to her lungs? So in the summer, of course, she had a chemical burn, and so that could have caused scarring in her lungs, and then caused portions of her lungs and have some fibrous changes and to be non-functional because of the scarring. And then of course then she gets pneumonia on top of that, and she's got congestion and inflammation, etc., around her lungs. So let's talk about cellular injury due to toxic substances, microbes, and immune reactions. So toxins, you can be exposed directly or indirectly, or chronically. So direct exposure, it means that you got it, directly on you, or you inhaled it. So for example, if she inhaled those chemicals, that would be a direct exposure. Indirect exposures usually are like they're part of something else. Could be low levels of something in a food. That would be more of an indirect exposure. And then chronic exposure is when you're exposed to a little bit over a long period of time. So a little bit every day, or a little bit on a regular basis over months to years. The exposure, I'm sorry for I'm obviously getting a cold. The exposure that she had was not a chronic exposure. The exposure Perline had with mixing the pool chemicals would have been acute exposure, and it would have been a direct exposure to a toxin, to a chemical. And microbes, some produce exotoxins and some produce endotoxins. So exotoxins are chemicals that the microbe can secrete that floats off into your bloodstream and has effects on your body. There can be effects such as liquefying your cells so it can enter in there. It can cause clotting. It can cause all kinds of different reactions. It can cause fevers too. And then some can produce endotoxins. So endotoxins are parts of gram-negative cell walls. When the gram-negative bacteria is destroyed, the pieces of the cell wall are released, and they can produce, some immune reactions, but definitely fever. And for example, viruses also can cause cell destruction because they invade the cell, take over the cell, replicate in the cell, and then they burst out of the cell or bud out of the cell, eventually causing cell destruction. Immune reactions, so you have cell-mediated immunity that will destroy your viral infected cells, and then those cells, as they're being destroyed, can release enzymes, and those enzymes can even cause damage to nearby tissue. So, for example, that would be in the case of hepatitis. Your hepatocytes are damaged; they release AST and ALT. And of course, the inflammation and the damage can cause damage then to the adjoining tissue. So, again, still on Perline's case, how will this affect her long term? So whenever you have an injury like that to your lungs, like she suffered with the inhaling of the chemicals, and there's scarring and all that, then from here on out, she's going to be more susceptible to lung diseases, to pneumonias. It's just going to be, she may get out of breath easier. So there's always long-term effects, because once scars are formed, scar tissue is not reversible. It doesn't go back to normal tissue. Next, so what diagnostic tests would help assess that type of cellular damage? So because we're dealing with the lungs, your choices are going to be ABG, CBC, BMP chest x-ray, CBC, BMP CT scan, CBC, BMP amylase and lipase. So you can already rule out this one because amylase and lipase has to do with the pancreas. We're dealing with the lungs. So of those are they're both good answers, but the best one is probably going to be this one, I would say, because of the ABG. Because you want to see how her gas exchange is going, especially with her having pneumonia. She's got that damage. You want to see the chest x-ray. That will be able to show you where the consolidations and where the pneumonia is in the lungs. Although a CT scan would too, this one would be more helpful. All right, next we got another case. So Dan is an older gentleman who has recently been diagnosed with lung cancer. He comes from a lower socioeconomic class. He has smoked all of his life. He has decided to continue smoking against medical advice and also try the chemo and radiation treatments. So what factors led to Dan developing cancer? Again, this one is not a really hard question. So what can lead to cancer? A lot of times is repeated exposure to chemicals, to toxins, to things that are just harmful to your body. Sometimes that can be, knowingly through smoking. It's a choice that is made, and sometimes you can be exposed unknowingly through things that are in our food systems and chemicals that we clean with, and then you can get this like low dose exposure over time. Just like, for example, Roundup glyphosate is now linked to, lymphomas and other cancers and leukemias and other cancers. And it's been used on our crops. It's detectable in cereals and, brand name cereals, breakfast cereals that you buy, and so if somebody has eaten, cereal all their life for breakfast, they could come up with lymphoma. It's quite possible. Cellular injury, let's look at nutrition, genes, aging, and cancer. So on the nutrition end, let's talk a little bit macro versus micronutrients. So your macros are your carbs, your proteins, fats, etc. So, and how much of those you eat and your ratio of that. We have in the U.S. plenty of access to that, to calories, to, sugar, to carbs, to protein, to fats. That's usually not an issue. Eating too much of those is an issue. The micronutrients are your vitamins, your trace minerals that are necessary, and even minerals. Just write out minerals like your sodium and your chloride and your potassium and your calcium that you need, but also your zinc and your magnesium and your selenium and your vitamin C's and vitamin A and B12 and all of that. And if you eat a lot of processed foods, you're going to get a lot of your macros, your carbs and fats, etc., but you're not going to get your micros. And lacking these can cause a lot of chemical reactions in your body to not happen properly, and eventually over years and years of eating that way can lead to disease. Genes, you can have mutations in a genetic code, and then it causes altered or missing products. You can also have epigenetic changes, which are changes in which genes are turned on and which genes are turned off and what they do. Aging simply affects all cells. Again, we talked about programmed death versus necrosis. So programmed death means that there are certain cells in your body that have a certain lifespan. Some it's a few days, some it's much longer than that. Some of them in weeks or months, and they're replaced. Once their programmed death happens, they're replaced with newer ones. Necrosis is when you have a cell death rate that's higher than what you can replace, and then you have, so you have tissue necrosis then. So death of the tissue. And cancer happens when genetically damaged cells continue to proliferate and function. Ideally, your immune system works to remove those and they don't proliferate. But if they are allowed to proliferate and your immune system can't stay on top of it and remove them, then there will be cancer, and there will be evidence, usually by tumors, or an increase in the amount of cells in the cases of leukemias. So let's talk about changes in body chemistries. There are 5 biochemical mechanisms that causes change in body chemistry. Loss of energy, so as in loss of the ability to make ATP. And this is what we've referred to again already. Usually your ideal way of making ATP is through aerobic respiration using oxygen and glucose, and that leads to adequate amounts of ATP in your body. But if you do not have enough oxygen reaching your tissues, then you will go into anaerobic respiration and create a lot of lactic acid and a lot of acidity in the body. And then that in itself can cause more damage. Mitochondrial damage can be caused by ions, toxin, and it can cause apoptosis of the cell. The mitochondria is where energy production happens. A lot of things that damage the mitochondria then affect the electron transport chain and the cytochromes, and then so even if you have enough oxygen reaches it, if this electron chain, the cytochromes are damaged, then you have a lack in the production of ATP. Loss of calcium homeostasis. If calcium is released in the cytoplasm, it can cause cellular damage to the membrane, to the cytoskeleton, and to chromatin. Normally it's contained, right? Defects in membrane permeability. So this could be mostly due to eating too many bad fats. So your trans fats, anything that has hydrogenated oils, are not good for you. And it causes loss of membrane fluidity, which then can cause problems in the permeability, and things can be leaking in and out of the cell. And that can cause some issues. And then the generation of free radicals. So they're highly reactive atoms that damage the cell membranes and DNA. Those are free radicals. Things like smoking generates a lot of free radicals, exposures to radiations and chemicals, various chemicals can cause those highly reactive atoms, those free radicals, to damage your cell membrane and your DNA. This is a matching little game for everybody that's on Nearpod. So moving on to Cesar's case, he's a 45-year-old Hispanic man. He complains to his physician about a sore on his chin. He was clearing away yard debris at home. A dirty branch poked him in the chin, and it broke his skin. Within 36 hours, his lower jaw became red, swollen, and painful with a pus-like discharge. So why would you describe this wound as inflamed or as inflammation? So this is simply on what is inflammation. So what are indicators of inflammation? You can list those in the neuropod activity. Generally speaking, just think of a scratch or a bite that you've had. You should see some swelling, some redness, probably some pain, and some heat. Cesar had a skin injury from a branch. List something else that could cause inflammation. So just anything you can think of that can cause inflammation. Talk about the inflammation process. So it is the body's response to injury, whether it's traumatic physical injury or is due to microbes. It is a protective response. It is very non-specific. So again, it doesn't matter if there's injury, no, any kind of injury, inflammation is going to be there. So the causes of inflammation are infections, mechanical damage, ischemia, nutrient deprivation, genetic or immune defects, chemical agents, temperature extremes, and ionizing radiation. Cesar's cause obviously was mechanical damage because of the scratch, the scratch of the branch was like a traumatic one. The immediate response of inflammation is that in the blood vessels, once you have an injury, the arterial, venous, and capillaries will constrict to limit the damage, and but then past that, they will dilate to increase the blood flow to the area, so that you can get the white cells in the part of the immune system that is needed to help battle and heal and repair the injury. Warmth and redness is going to be seen at the site from that blood vessel dilation. And then you will have an increased vessel permeability that's going to happen in those blood vessels, allowing it to leak fluid in the extracellular space. And of course, that gives you the edema. But it also allows the white cells to be able to leave the blood vessels easier and get to the site of injury. And then chemical mediators are released also, and those are going to be prostaglandins, histamines, leukotrienes, and other chemicals. A little bit about prevention and healing. So one of the things that the body does is if there's any toxin, is going to try to dilute toxins with extra fluids. It can activate different cascades. So there's a clotting cascade and a complement cascade. And the way they turn those on is they activate inactive proteins that are floating in your body that again activate it either to, release complement or to clots. There's the attraction of neutrophils, monocytes, and macrophages to the area to start the healing process. And then the inflammation is also controlled so that this process does not spread. It stays localized where the injury is, and it does not cause damage to healthy tissue. And then, of course, antibodies should interact with the pathogen to neutralize it. And lastly, the body has to remove any debris, any, of the dead white cells and dead pathogens and damaged tissue. All of that has to be cleaned up, removed, and replaced with newly made tissue. So let's continue with Perline. So she was diagnosed with bacterial pneumonia caused by Streptococcus pneumoniae. Which complement pathway you think would have been activated first? We're going to talk about those for a second. And what will be the effect of complement pathway activation? So let's think about that in the complement system. So the complement system is a defense against bacterial infections. There are three pathways: the classical, the alternative, and the lectin pathway. The classical pathway activates by antigen and antibody complexes. The alternative pathway is activated by bacterial endotoxins, so that's usually gram-negative bacteria, yeast cell walls, and snake venom. And the lectin pathway is going to be dependent on the binding of lectin to mannose on the surface of a pathogen, such as HIV, RSV, Salmonella, or Listeria. Those are just examples. So in Perline's case, I would say simply the classical pathway with antigen-antibody complexes of that strep pneumo and the antibodies to the strep pneumo. What makes sense because strep pneumo being a gram-positive, cocci does not do endotoxins. That's a gram-negative rod usually that does that. It is not a yeast cell. It is not snake venom. It is not an HIV, RSV, salmonella. There are 4 outcomes to complement activation. Mast cell degranulation, which causes the release usually of histamines. Leukocyte chemotaxis, so releasing chemicals, those complements that are released will attract leukocytes to the site of injury. Opsonization, which is the coating of the bacteria here, the strep pneumo, with antibodies, so that it can be engulfed with by the macrophages, and of course cell lysis are all outcomes of the complement system. All right, so which complement pathway should have been activated first? I've already answered that to you. Just select it. And what is one outcome of complement pathway activation? There was 4 that were just listed. So next, let's talk about the clotting system. So there are 3 pathways in the clotting system: the intrinsic, extrinsic, and the common pathway. So the intrinsic pathway is activated when factor 12, factor 11, or prekallikrein are exposed to and are adsorbed on collagen, plasmin, platelet surfaces, or kallikrein. The extrinsic pathway is activated by the release of tissue thromboplastin, or tissue factor, from damaged blood vessels. And then, so you start one or the other, and then they can join into the common pathway. And the common pathway is a combination of the intrinsic and the extrinsic pathways and results in a stabilized clot. So you either activate intrinsic and then go to common, or extrinsic and go to common. It's usually what happens. And then you get a clot. The function of the clotting system in relation to inflammation is that it prevents the spread of the infection, it physically traps organisms at the site of injury, it stops bleeding, and it provides the structure to repair the injured tissue. Perline has pneumonia. Could her infection activate the clotting system? What do you think? Yes or no? All right, the kinin system. You have bradykinin. It's activated by kallikrein, and it dilates blood vessels. It acts with prostaglandins to induce pain. It contracts smooth muscles. It increases vascular permeability, meaning the vessels will leak their stuff easier. And it enhances leukocyte migration to the area, of course, so that they can fight the infection. The molecules in one system activate or interact with the molecules in the other system. So kinin system, clotting system, complement system, they're all interrelated. For example, kallikrein can activate complement 1, bradykinin, and also converts plasminogen to plasmin. Control of the inflammatory process. So there are various enzymes that can inactivate complement components and degrade histamine, kallikrein, and plasmin. For example, C1 esterase is a regulator molecule that can inhibit all 3 systems. So you don't want these systems just running amok and causing all kinds of problems, because then you definitely have problems like maybe a clotting problem in your body. So, list the consequence of the presence of the bradykinin on Perline's lungs. All right, so let's talk about the chemical mediators of inflammation. So, these are some we've already mentioned. There's histamine. They're contained in mast cells, platelets, and basophils. Histamines give you all the signs and symptoms of what you take antihistamines like Benadryl for. So, runny nose, sneezing, hives, that kind of symptoms. Serotonins are released by platelets. Your lysosomal enzymes are released by neutrophils and macrophages to destroy pathogens, usually within the pathogens that they have engulfed, so within vacuoles. Prostaglandins are released by leukocytes, platelets, and endothelial cells. They can cause pain, and again, inflammation in the area. Your leukotrienes are released by leukocytes. Your cytokines or cytokines are released by lymphocytes, macrophages, and endothelial cells. And these plasma chemical mediators include some of the components of the complement, clotting, and kinin systems. Another little matching exercise if you're a neopod. So the mediators of acute inflammation will include the complement components, prostaglandins, bradykinins, histamines, leukotrienes, and cytokines. The cytokines include interleukin-1, interleukin-6, interferon gamma, and tumor necrosis factor alpha. Chronic inflammations are different than acute inflammation mediators, and they include prostaglandins, leukotrienes, cytokines that are listed above. So again, your interleukin-1, interleukin-6, interferon gamma, and tumor necrosis factors, and bradykinins. So let's talk about the chemicals produced. So cells produce chemicals, so chemokines and cytokines, such as interferon, and they usually act locally, so in the area where the trauma, the damage, the infection is. There are some that are pro-inflammatory. So systemic pro-inflammatory cytokines, so if they're present, they're going to generate inflammation. Are interleukin-1, it produces fever. Interleukin-6 produces fever and also signals the liver to produce acute phase reactants, and it signals the bone marrow to produce immature blood cells, your white blood cells, to come fight the infection. Anti-inflammatory cytokines are interleukin-10 is anti-inflammatory, and it will inhibit the cytokine production again, or cytokine production, because you have to have an off switch to this also. So you want to create inflammation when it's necessary, but then you want to be able to turn it off when the infection is over. Acute phase reactants are produced in the liver. They can be positive or negative acute phase reactant. Positive acute phase reactants increase when there is an infection or inflammation. So C-reactive protein is one of those. Negative acute phase reactions decrease when there is an infection. I know, like retinol binding protein is one of those. So some go up, some go down. Fibrinogen, alpha-1 antitrypsin, complement proteins, and C-reactive proteins are all acute phase reactants. All right, Perline's hospital stay for pneumonia would be classified as acute or chronic inflammation. Which do you think? So acute inflammation, which is what Perline has, is localized and short term. You usually see exudates, which are fluid in the interstitial space. So you have some edema, some swelling. The exudates is clear and watery. If it's just, if there's no infection, and it's cloudy, thick, and full of leukocytes if there is an infection. Characteristics of acute inflammation are going to be local effects. So you have locally, usually you have the redness, pain, swelling, edema, etc. But then systemic effects of acute inflammation, which is what you would be more likely to see in a case of pneumonia, like Perline's case, would be fever, leukocytosis, so higher white cell count, a shift to the left of your neutrophils, so meaning an increased percentage of neutrophils on your diff, of your CBC, an increase in acute phase reactions such as CRP, fibrinogen, and etc. Also drowsiness, malaise, anorexia, and myalgia. And chronic inflammation, that would be an inflammation that is at least longer than 2 weeks and generally lasts weeks to months. It's histologically and mechanically different from acute inflammation. You do see infiltrates of white cells, and they can become granulomas, which is the body's attempt to isolate high numbers of macrophages. It goes from non-specific, acute is very non-specific, to chronic, which is more specific defense. So you will see some monocytes and macrophages, they're non-specific, but then more specific, you'll see an increase then of B and T lymphocytes because they are part of the specific immune system response. And then you will see also phagocyte death because this is going on for longer than 2 weeks. So the cell lyses and releases lysosomal enzymes that can lead to additional tissue damage and the continuation of the inflammation process. So as the macrophages die and release those enzymes, if those enzymes aren't neutralized, then it will damage the lungs in this case, a patient's case, if the inflammation continues, if the pneumonia continues. Alpha-1 antitrypsin is an acute phase protein, so it increases when there is inflammation and infection, and it is elevated during this inflammation process to minimize the effect of those lysosomal enzymes. Patients that don't produce alpha-1 antitrypsin or not enough then will sustain damage wherever there's infections, and that will cause scarring and fibrosis due to the damage of the lysosomal enzymes to the tissue that was not able to be neutralized by the alpha-1 antitrypsin. So if Perlene is deficient in alpha-1 antitrypsin, then this would cause her to develop emphysema. This would be an example of acute or chronic inflammation. So this emphysema, which would it be? And the fact that she is lacking alpha-1 antitrypsin. So a couple of lab tests that are related to testing for inflammation. So in chemistry, we can run the C-reactive protein. It detects inflammation, and that is all it can tell you. Is there is inflammation that is present. It's up to you to find out where it's coming from, or up to the doctor to find out where it's coming from. The function of C-reactive protein is to activate the classical complement pathway by binding polysaccharides of microbes. CRP levels rise quickly and exponentially in response to an injury and to inflammation. The levels of CRP can increase up to 2,000-fold and begin to increase within 6 to 12 hours of injury or infection, usually peaking at 48 hours. The level of CRP tend to correlate with the degree of damage. So the higher the CRP is, the higher the damage, or the more inflammation there is. And the lab procedures it's usually done by ELISA, immunoturbidimetry, nephelometry, immunofluorescence, or immunochemiluminescence. And there is a difference between CRP and high sensitivity CRP. So if you ran just a regular CRP, you would pick up inflammations due to things like pneumonia or the flu or infectious processes or massive injury. High sensitivity CRP is meant to detect low-grade inflammation that is chronic, which can lead to atherosclerosis and blockages in the heart and the coronary arteries. And so its function is not to detect acute inflammation, but to detect chronic low-grade inflammation. A few other tests. So we can test for complement for C3 and C4. We can test for fibrinogen. It would be expected to be elevated during inflammation. We can test for alpha-1 antitrypsin, which again prevents tissue destruction by blocking the enzyme leukocyte elastase. You would want your patient to have an adequate level of dose. If they don't have enough alpha-1 antitrypsin, it's a problem. Cytokines or cytokines are usually not tested. So when you see things about interleukin 1, interleukin 6, tumor necrosis factor alpha, those usually are within the context of research. So, I mean, they can be tested. There are test kits out there for them. It's just not clinically done. And of course, your hematology test, the CBC, at least you can use a white count to see, and the differential to see if you are dealing with an infectious process and if it might be bacterial or viral. The CBC can definitely help with that. Okay, and this is your last slide. If you're on Nearpod, if you have any questions, feel free to ask them. If not, ask them below in the comments, and you guys have a good day.